Hello, I'm Wally Haas. I'm Executive Director of Transform Rockford and your host for Rockford on the Record. And today's guest is Mary Trujillo. Did I say it right? Did I get it?
Yes.
Okay. All right. I tend to slip up on some names. But Mary is the Mental Health Program Manager for the City of Rockford. And her group does a lot of good work in the community. I was first alerted to what you're doing by Jason Holcomb, the Region 1 Planning Council of the Region 1 Planning Council. Jason was a guest on one of our episodes previously. I'll try to link to that somehow in this if I can figure out how. But anyway, but Mary, Jason was praising a lot of the work that you do, and especially your crisis response. Well, actually, let's back up. Let's back up a little bit. I'm sorry. I'm getting ahead of myself here a little bit, which I tend to do. If you've ever watched any of my other programs, you know how well scripted these are and how often we go off script. But first off, let's just start a little bit about your background. How did you get into this work?
Sure.
And why do you think it's important?
Well, I come from a mental health background, so I have my master's in social work, and I've been in the social services field for over 15 years. Started out working with families who are in transition with the school district, and then also as a school social worker with RPS 205 as well. So I've worked a lot with families and youth and students in crisis situations, related to homelessness, mental health issues, and all of the above. When I saw this position with the city to work with these crisis teams that go out into the field, meet individuals where they're at, I just thought that was a perfect, role for me to pursue. I was born and raised here in Rockford. I'm really invested in Rockford and trying to, make things better. And I kind of was ready to look to try to do that on a larger scale, kind of that kind of macro social work, larger systems type work. So I'm also a licensed clinical social worker, so I've done some private practice as well. So that's kind of my background, and why I chose to pursue this role. Actually, today I've been in this role for exactly 1 year. Today's my 1 year anniversary, so that's exciting.
Congratulations.
Thank you. And, I think over this past year, I've just learned so much about, these big picture of the ecosystem of crisis services, in Winnebago County, and, how all of these other smaller systems or mid-level systems function within the bigger system. And so that's been really fascinating to kind of sit back and, assess, kind of look at the data, but then also look at the stories that, the teams that are on the ground, doing the work in the field have told me about, families and individuals that they've helped. So it's been really, really exciting and interesting, and I'm really excited to kind of see what's next for the next year. So
Was this a new position that was created
Yes.
to meet a specific need in the community?
Yes, so this position was created. It was a newer position, and it's basically to kind of be that liaison between the City of Rockford, the Winnebago County Community Mental Health Board, because our programs are fully funded by those programs, as is my position, and then also to be a liaison between all the other collaborating organizations within those programs, and then also to ensure that we're implementing best practice or emerging practices in those programs. Co-responder programs and crisis programs, they're not new, but regarding research and best practice, some of that is still being developed, still being kind of assessed. So it's a newer field, so to speak. And so it's really important that there's kind of that oversight to ensure that we are doing best practice and that we're continuously improving, what we're doing. I think that the teams do amazing work, but I also am under the impression that, like, you always want to be making improvements. You want to, look at, what are the strengths and what are the areas of challenges, and improving on, those strengths and building on those. And then also, what else can we be doing to really meet the needs of the community? So I think, that's something that's a huge value for me, to really look forward, like, what else can we be doing?
Now, you mentioned best practices. Now, what I've been told is that your organization is the best practice.
I've heard that a lot as well, and I do agree. I think that, we are ahead of the game as far as a lot of other co-responder programs, crisis response programs. A lot of what we do is very unique to this area, I believe. I think especially in the state of Illinois, I think we do have one of the strongest crisis response ecosystems, I would say, and systems in general. I think that, there's other organizations throughout the nation that are doing similar programming. And so I've, done a lot of research and kind of looked at those other programs as well. And just to kind of get new ideas. But yeah, in this area, we are definitely kind of in the lead for those type of crisis response programs.
So since this is a newer program, how did you start? How did you figure out what you needed and how you would move forward?
Sure. So the two programs I oversee is the Crisis Co-Response Team, or CCRT, which is a collaboration with Rosecrans, the City of Rockford, Rockford Police Department, Loves Park Police Department, Winnebago County Sheriff's Office. So that's one of the programs. And the other program is a collaboration between UW Health and Rockford Fire in the City of Rockford. So and that's called Mobile Integrated Health and Mental Health Program, or MIH-MHP. So CCRT is now starting off their 4th year. They just completed their 3rd year. And then MIH, for short, has started their 3rd year, just completed their 2nd year. So, so the programs were up and running when I started my role. And so I know that in the beginning, they just had pilot program running, and they kind of just were looking at other, models that kind of were running throughout the nation to kind of see what they could do to get started. I think the partnerships that we have with law enforcement and Rosecrans has grown over, the past several years and really flourished. Really, I think the partnerships between all of these collaborating organizations, UW Health, Rosecrans, the city, and all these other law enforcement agencies have just really grown throughout the past several years through these programs, which is so important because those are the first responders often that attend to those mental health calls for service. And so we now have programs in place that can send a law enforcement, a clinician and a officer to the scene if it's a situation that's mental health related, instead of, having it go through a patrol officer who, may have some training in mental health, but it's just really not the appropriate response.
So walk me through some of the steps. Someone's having a mental health challenge.
Sure.
And how does that? What's a normal? Well, there's no normal, right? Okay. I mean, nothing is typical in this field. But what happens when a person is having a challenge that needs some intervention somewhere?
So, an individual who's having a mental health challenge, can call 911 and they will get, 911. They will send a patrol officer, but if there's a CCRT unit that's available, then they will send them out as well. Oftentimes, patrol might arrive on scene first and, ensure the scene is a safe scene, and then CCRT will come in and pursue the individual who had called for the mental health challenge. It doesn't always happen like that, of course, but that's one situation that could occur. So CCRT does live calls, which they go out to the call in the moment. They also do follow-up calls, and they also do calls where they get referrals from patrol officers who went to the scene, and then they'll go and do an initial contact, within 0 to 2 days. If they can go that same day, they might go that afternoon or the next day. It just kind of depends.
Are they available 24/7? How does that work?
So CCRT runs currently from 6 a.m. to 11 p.m. Monday through Friday. And then we are looking at ways to bridge the gaps between the hours in which they're not in service. The city is really looking at the data to determine that call volume and what is the need and how can we meet that need. So we are looking at what are different ways that we can be creative and make sure that there's an appropriate response all times of the day, all hours, what that will look like. We're still kind of looking at the data and kind of trying to figure out, what is the most appropriate response.
Now, according to a story that published by WREX in March, In 2023, you served 1,900 individuals. Does that sound right?
It does, yes.
And then so far, as of March, you had served already 1,200 in 2024.
Mm-hmm.
Do you have any idea what the numbers are today?
Well, I do have the numbers, and the way that the data is ran, it's not calendar year. And so what the numbers that I have today to compare to kind of give you an idea. So in our program year 2023, we served a total of 1,950 individuals, unduplicated individuals for CCRT. And then in program...
Excuse me a second. You said unduplicated. So these are individual, each
Yep,
individual.
unique
This
individuals.
This is not somebody who's coming back for service time and time again.
Correct.
Okay.
Correct.
Thank you.
Yep. So in program year 2023, we served 1,950 unique individuals. And then in program year 2024, we served 2,321 unique individuals. So that's a comparison from one program year to the most current program year.
And what are some of the challenges that these individuals face, and how do you help them?
So actually, what they do is they go to that initial call, whether it be following a 911 call where they go to a live call on scene, or whether it be the next day or a few hours later where they'll follow up or do an initial contact with an individual that was referred to by, it could be another first responder, it could be law enforcement, it could be an organization that has a referral. And so they'll go to that initial contact and they'll do a suicide assessment or a risk assessment if that's warranted. So if the individual is having suicidal ideation or any sort of suicidal thoughts, they'll do an assessment to determine risk and determine next steps. They'll create a safety plan with that individual. And the whole idea is to ensure that individuals who do need to be served at the hospital and assessed there are, but then those individuals who really don't need to be, sent to the ER and, going through that whole process, that they're not. They're given the appropriate resources to really be able to overcome whatever mental health challenges they're facing. And so they'll do those assessments to determine what are the best next steps. And then after that, they do follow up. So they do follow up, pretty much as long as that individual needs assistance within reason. They'll go out to the home, make sure that that individual has, made their appointment. If they assist them in maybe making an appointment for a mental health provider, they'll follow up and ensure that they went. They may go to the home and, talk to them, have you, went to the doctor? Have you made, taken your medications? And they'll kind of making sure that they have those wraparound services in place. And if they don't, they'll link them to those services. So that's another thing that they do is a lot of that linkage to service. They also do, actually both programs, both CCRT and MIH, both are really active with doing Narcan training. They'll train individuals who have experienced overdose or perhaps like family member of an individual who has experienced an overdose on how to use Narcan to prevent future overdose or to remedy if an overdose were to occur. So there's a lot of that psychoeducation and education piece also in both of these programs actually that they'll do.
Okay. Now, your response team, that seems mostly reactive. Is MIH more proactive?
So MIH does a lot of early intervention and some prevention. They do also some prevention in terms of education in the community on different mental health issues, and they do CPR training, they do Narcan trainings, things of that nature to make sure individuals are aware of safety measures for mental health issues. They also do early intervention. So when individuals are, maybe they go to the ED because they are having a mental health challenge, and they go to the ED, they're assessed, and then they're released. Maybe it's not a situation where they're actually admitted, but they still need assistance, of course. And if we don't provide assistance, they're going to kind of end up back in that same situation. And so they will be able to intervene at that point and receive those referrals from UW Health to be able to follow up with those individuals and provide resources in that, the next day or the following day. They also receive referrals from the individuals who are admitted for mental health. So with MIH, they're Rockford Fire and UW Health, and they're psychiatric nurses from UW Health they do rounds on the fourth floor. They're very familiar with individuals who are admitted for psychiatric reasons, and so they're very familiar with that whole process, and they get referrals from the Center for Mental Health as well. And so they're able to capture those individuals early on to be able to really ensure that they have resources to get what they need and link them up to services. So both programs do a lot of linkage to services.
How can family members help their loved ones deal with some of the issues they may be facing?
So I think that there's lots of ways that family members can assist their loved ones. I think it's really difficult at times because there is such a stigma with mental health and mental illness and substance use disorder even. I think a lot of people, even those who are in the mental health field or even family members who are, have a loved one with mental illness and they're very well versed on what that mental illness looks like for that person, there's still that stigma, there's still that fear. And so I think the best thing that individuals who have family members who are experiencing mental health challenges or substance use challenges is really reaching out to support groups, to educate themselves with the resources that we have here in the community. We have so many amazing resources, a lot of them funded by the Mental Health Board, that really can provide those wraparound services that we talk about. I think that there's so many amazing resources here, but sometimes there's a disconnect between those resources. So I think the best thing that people can do is just reach out. And, us as organizations, we're trying to reach out to the community as well. But, we can't, sometimes it's hard to reach everybody.
Yes.
And so I think I will definitely, say NAMI has some really good support groups. There's a lot of other organizations that have really good support groups and different resources. Actually, if you go to the Winnebago County Community Mental Health Board's webpage, they have a list of all the different programs that they fund, and that will give you an idea of some of the other mental health programs in this area. And so that's kind of a good starting point for individuals seeking resources and to get more information about what the different organizations do.
Okay, very good. How do you measure success?
So right now, what we're looking at for success factors for CCRT, I think we're just really looking at, individuals being linked up to services. One of the other things we look at is maintaining a less than 4% incarceration rate. The whole point of these programs is to ensure that individuals get a behavioral health response to a behavioral health challenge, right, and not the lights and sirens, not the police response automatically, or not the fire and EMS response automatically, because oftentimes these are things that can be addressed with resources and some support that way. And so we look at really trying to prevent unnecessary arrests and unnecessary ED visits and admissions. And so for CCRT, we maintain less than 4%. And I think it's actually even lower because some of that data is coming from, if an individual has a warrant or, things of that nature that's unpreventable, and then police is on scene. And so sometimes diversion can't happen. Right. But we, are aware of that, and there's lots of different diversion efforts out there, and we're doing our best to make sure that if it's a situation where they should not be any related to the justice system, that we keep them away and we get them the services they need through the behavioral health systems we have. And then with MIH, we look at ED visits, and we look at the percent of ED visits have decreased over 25%. Actually, around 53% it's decreased this past program year for individuals who were not receiving services from MIH, and then they were, admitted to the ED, and then afterwards they were receiving services. So we look at those decreases in the ED visits based on those interventions provided by MIH. We look at the decrease in arrests. another success factor for CCRT, they work very closely with the wellness track through the Winnebago County Justice Center. And so what that is I don't know if you're familiar with the different problem-solving courts that they have.
Yes.
They have like the mental health court and drug court, veterans court. Well, they have a newer court called the wellness track through Judge Gibbons. And CCRT has worked very closely with that program to ensure that individuals who have committed very lower level misdemeanor crimes such as trespassing or things of that nature, many times due to mental illness, they're able to go through this other track and work with CCRT, work with some other community resources to get those charges dismissed if they, follow through with these, their appointments and all of that. And they really are able to link them up to services to keep them out of the justice system. Because we know a lot of those lower level crimes, it's due to their mental illness.
Right. Yeah. Winnebago County has been a leader in these specialty courts that you mentioned.
Yeah.
Whether it's drug court or mental health, it's Winnebago County has done a very good job with that over the years. So, we've talked, a little bit about the mental health board and the funding mechanism that helps finance all the good work that you're doing. Now, would you be able to do it without that?
That is a good question. I think that without those resources, we would not be able to reach this number of people. The numbers that I gave you, every year they've went up. And not that, I think helping more people isn't always, a success factor necessarily, but then again, it can be. So I think that, it's really important to demonstrate that we have, our numbers have went up. We've been helping more and more people each year as we kind of are figuring out how to more efficiently get to people quicker. And so I think without the funding from the Winnebago County Mental Health Board, and without individuals voting for that sales tax, we would not be able to do the work we do to the magnitude that we do it. It would be a much smaller reach. And so that would be not possible without that.
I mean, for years, Winnebago County did not have a dedicated funding stream for mental health services. And then the voters passed the mental health tax, half cent on the dollar, mental health tax,
2020.
2020. Okay, thank you for I'd have to look that one up. I couldn't remember it off the top of my head. And it's on the November ballot. And so if you want to see the good work that Mary and her team are doing continue, please vote yes when you get to it in November. So what haven't we talked about that we should talk about?
Well, I think that we've talked about a lot. The only other thing that I would say is that I think that with CCRT and MIH, both of these programs aim to really provide a behavioral health response to a behavioral health crisis, right? And I know that there's a lot of other community services or resources out there that also provide crisis response, not in the way that these programs do, but they're part of the kind of that crisis ecosystem. So I think one of the other things that I'm looking at kind of as a vision for the future is really focusing on, what does that crisis continuum look like? And what does the ecosystem look like to ensure that we, first of all, identify those gaps in the crisis continuum and really figure out ways to address those gaps. And I think the only way to do that is to have all the crisis programs really collaborate more together. I think that there's incredible collaboration currently with all these organizations. They all are pretty well versed on what each other does. We get referrals back and forth with some of these organizations that are also receiving funding and some that aren't, that are also mental health services. But I think that there's still a need for a more strategic collaboration between these different organizations. And so I think that that's something that I'm excited to kind of like look towards the future to really kind of kick it up a notch and do even more, good work really in the community. And so that's kind of another thing that I kind of wanted to touch on.
So how do you convene all of these partners to help, row the boat in the same direction?
That's a good question too. And, I've been talking to some different individuals in this area about how to kind of address that. And I think to begin with, it's really just reaching out to different organizations and kind of really asking a lot of questions, having just conversations like you and I are having, just sitting down, talking to different organizations, kind of seeing what they identify as strengths and weaknesses of the crisis continuum in this area and of the organization as it relates to the crisis continuum. And then really just kind of pooling that information together as data at that point, and then really trying to figure out, okay, what are the gaps? And there has been some other initiatives to really identify those gaps. And so revisiting those other initiatives perhaps and looking at, okay, this is where we were at. Now what do we need to do? Because this is where we're at now. So, yeah, I think that's kind of like the first step to kind of accomplishing this really big vision of getting different organizations. Because the other thing is that, we don't want to create a situation where we're just meeting to talk about crisis stuff and just to have meetings, and because that happens a lot too. There's a lot of situations where we go to meetings to hopefully accomplish a goal, but then we wind up sharing updates about organizations and what they're doing, which is also very important and necessary. But this is something that I'm thinking it would be more a strategic plan to figure out what do we need to do to fill those, what are the gaps, what do we need to do to fill those gaps, and what have we not done in the past. And so that's kind of how I see approaching that challenge.
Well, one of the things that I think has been a success is that you've raised awareness of what the challenges are in the community and what the resources are that can be used to help meet those challenges. And I think that's, when you talk about number of people served, sometimes it's an indication of people finally realizing, hey, I can go there for help.
Yeah.
So.
And I've talked to a lot of different providers, and they've kind of had that same sentiment. And even to talk about services to ensure that they're inclusive to all individuals in our community. For example, I was talking to an organization, and they were, telling us how they have a lot more individuals coming to their organization now who speak Spanish because now they have a Spanish therapist there. And so that's just an example of how I think over the past several years, we've really done a really good job at making sure that we're providing inclusive resources to everybody, and we're really getting the word out to all of our community members.
Well, thank you very much. Any final thoughts?
Nope. I think we kind of summed it up. I think that, the biggest thing is that, these programs are out there for the community to utilize, and it's important to get community feedback too. So that's always welcomed.
All right. Hey, thank you very much, Mary. Now, you've heard that Mary and her team do a lot of good work, and I've said it earlier in the broadcast. This is all possible because of the mental health tax that will be on the November ballot for renewal. And so I encourage you to vote yes so that Mary and her team can continue the good work that they've been doing. So, hey, thank you very much, Mary. I'm Wally Haas. Thank you very much for watching.